There are basically very many causes of epilepsy. However, in today's video, we have brought you the commonest causes of epilepsy. And we are going to discuss basically 10 main causes of epilepsy. And these include, number 1, genetics or a family history of epilepsy. This is the commonest and the leading cause of epilepsy in Uganda and world all over. If parents have epilepsy, they are on a high chance of giving birth to children who have the disease. Cause why? Genetics. The disease mainly travels or is mainly transmitted from one person to the next person via genetics or via genes. So it's normally common in people who are having a family history of epilepsy to give birth to children or to have grandchildren who are suffering from the same disease. Because why? They inherit the genes which are having epilepsy from their parents. 2, brain damage secondary to trauma. If an individual is involved in a motor accident and gets brain damage, the area of brain damage is always the source of epilepsy. 3, brain infections, for example, meningitis. Common infections or bacterial infections which affect the brain can predispose or can lead a person to developing epilepsy. Cancer of the brain or brain tumors. This is another common cause of epilepsy because a brain tissue is the brain tissue responsible for controlling the whole body. So if there is an abnormal growth of a cancer cell in the brain, that patient is most likely to get epilepsy or is most likely to get fits. And you can only identify this by doing brain CT scan. 5, stroke. This is another common cause of epilepsy in people who are suffering with hypertension and diabetes. Injuries before and during birth. When a lady is pregnant, they are fragile and they are vulnerable. Any damage, for example, trauma, physical damage to the pregnant mother, for example, via violence between a husband and the father, may end up damaging the developing fetus and hence cause brain undevelopment, leading to a cause of epilepsy in the unknown born baby. 7, developmental problems of children. For a child growing up from childhood to adulthood, the developmental milestones the past child should undergo through. But if a patient or if a child misses the developmental milestones, maybe due to torture, maybe due to lack of meals, maybe due to chronic medical illnesses, maybe due to malnutrition, a patient can get poor brain development, which in the long run may lead to epilepsy in the growing up child. 8, chronic illnesses, for example, HIV, diabetes, hypertension, can lead to fits at times. Cause why? A person with diabetes can get a stroke. A person with hypertension can get a rupture of a blood vessel in the brain, leading to cut off or leading to infarcts, which can in the end be the source of epilepsy. 9, idiopathic cause or unknown causes. At some instances, you will find an adult developing epilepsy, and yet none of the above causes is being elicited. However, the patient is diagnosed with epilepsy from an unknown cause. That makes the cause idiopathic. And number 10, etc. There are so many other causes of epilepsy which have not been stated. However, for more inquiries, contact me on my YouTube account, Facebook account, or my mobile phone for details. Thank you.